The American Cancer Society says leukemia is the most common cancer in children and teens in the U.S., accounting for 1 in 3 cancers. For a Tulsa family, leukemia is but one problem among many, and their 7-year-old sons fight for life.
This is what some of the kids do, the boom. Boom, there you go.
Nathan Gunn's doctors say he's the toughest kid in Oklahoma. In just 7 years, Nathan has survived more illness and injury than many people will ever endure. The problems began 3 years ago. At first, it looked like he had a cold.
He had a sniffly nose, treated him, had a fever, gave him medicine for that. Made an appointment with his pediatrician for that Friday, and that Thursday morning he woke up and he couldn't hardly walk. Right after he got to the hospital, she had told me that they had found leukoblast cells in his blood, meaning cancer, and that the next 24 hours would be critical.
And shortly after going to the emergency room, he had cardiac arrest and required CPR and actually was on a ventilator for a while. Nathan was diagnosed with our most common type of pediatric cancer, something called acute lymphoblastic leukemia, or ALL. ALL makes up about 25% of pediatric cancers. There are about 2,500 to 3,000 cases a year in the U.S. He got in a bad infection in his lungs on top of his leukemia, and that's what kind of set him over where he was really, really critically ill.
Hardest thing I've ever done in my life, you know. If it wasn't for, you know, my beliefs in God, I would have never made it. You know, being in the chapel, praying, talking to the chaplain, and, you know, it's just unbelievably, like, unimaginably hard.
You do a lot of blaming yourself, you know, of, you know, what you could have done differently maybe, or, you know, that's a really difficult thing to watch your child go through.
Yeah.
It's hard to watch your kid die in front of you.
Mm-hmm.
You know.
Nathan survived the heart attack and a lung infection and was responding to therapy at OU Children's Hospital. By September 2010, he was preparing to go home.
Everything was fine, and next thing you know, his blood pressure started going through the roof. He kept vomiting. He probably vomited 20, 30 times in a matter of a couple of hours. And we were trying to take care of him, and the last thing that he said was Ricky told him to open his eyes, and he said he couldn't, and we never talked to him for another month because he went into a coma.
Acute bleeding inside Nathan's skull threatened to damage his brain stem. Emergency surgery was performed, and it was another long road for Nathan and his family.
When he woke up, he knew us. He knew our names. He knew colors. He knew his brothers.
Mm-hmm.
He did have left side paralysis, but that was okay. You know, we would deal with that when it came time to deal with that.
Cure rates for Nathan's type of leukemia is somewhere in the 90 to 99% range.
Nathan's case is pretty extraordinary because he had a lot of problems along the way that most kids with ALL don't face. And so during the first just 3 to 4 months of therapy, he had several brushes with death. Our hopes are, you know, that he's not going to need to receive any chemotherapy, and most kids with ALL, Nathan's age, and who responded well to the leukemia therapy early on, do very, very well.
Chemotherapy has been hard on his body, and Nathan needs a kidney. In October, he will go on the waiting list for a transplant.
Toughest kid I've ever seen, you know. He's went through quite a bit. He never gave up.
He never complained. He doesn't seem to be bothered by all of this, ironically. He just likes to play.
Yeah.
He's come huge milestones.
Oh,
you know,
yeah.
that we never thought.
Leaps and bounds.
With a fighting spirit and a little help from his friends, this 7-year-old is happy to be going home to Tulsa.